Hello everybody, thank you for taking time out and joining us for this webinar where we will be discussing why live blood analysis gets bad press. So thank you for sending in your questions. We will be answering some of them on this webinar, and please feel free to ask questions throughout by putting them into the question box, which is the go-to webinar which you should be seeing on your screen. We'll endeavour to answer them throughout, but if not, we'll answer the questions at the end. So, live blood analysis, not so widely known in the UK, better known in the US, Russia and South Africa and parts of Europe such as Germany. It's a simple test conducted by a nutritional microscopist to get an overall picture of the blood. The practitioner begins with a small, painless prick of the finger with a sterilized lancet to collect a single drop of blood, and this drop of blood is placed on a glass slide and covered to keep the sample intact and to slow the drying process. So next, the sample is placed under a high magnification dark field microscope, which is linked to a television monitor or a screen. So with all the good things that can be said about this testing from complementary and alternative practitioners, there's also quite a bit of opposition. Now, in my experience, most of the opposition to live blood analysis is from sources that know little about it. For example, even Wikipedia, which we tend to use for all of our definitions in this day and age, defines live blood analysis mistakenly as a diagnostic procedure. So on that note, I'll begin with the first of the questions. So hello, Dr. Okker.
All right. Hi, good evening.
Our first question is live blood analysis used for diagnosis of disease?
Well, this is a very important question to ask because it addresses one of the fundamental reasons why live blood analysis is generally not accepted by conventional medicine. And that is that this expectation that it should work as a diagnostic tool. Now, any practitioner that has been properly trained in live blood analysis knows that it is not used to diagnose medical conditions or medical diseases. Its value doesn't lie in its ability to detect some medical disease from a single drop of blood, but rather to evaluate the state of the body's internal environment, what we refer to as the terrain. Now, this concept of the terrain is actually central to all natural healing modalities. Instead of looking for a combination of symptoms, clinical signs and laboratory test results to provide the client or the patient with a diagnosis of a particular disease, in natural medicine we tend to look much deeper. So we try to understand why a specific disease has developed in a patient by looking at several factors, such as the balance between nutrition and toxicity, or to put it differently, the balance between nourishment and poisoning, the oxygenation, pH, and hydration at the cellular level, and so on. Now, if we understand why a disease has developed, we know what needs to change to allow the body to heal itself. Now, this is where live blood analysis as a test really excels. It allows us to assess the condition of the terrain very easily and accurately. So to answer your question, it's not used to diagnose medical conditions, but it is extremely valuable to the practitioner who is looking for a way to pinpoint imbalances at the cellular level.
Okay, thank you very much for that. And the next question is, what is the scientific evidence for live blood analysis?
Right. Well, the first thing to mention here is that that many of the anomalies in live blood analysis were taken directly from standard hematology. We are looking at the blood, so we do see the same morphologies and anomalies that can be seen in peripheral blood smears. So signs like acanthocytes, podocytes, leukocytosis, keratocytes, hypersegmented neutrophils, and so on, are all described in hematology and have been subjected to years of scientific research. So there really isn't already sufficient scientific evidence for a large portion of the anomalies that we identify in live blood analysis. However, because we are looking at live blood that has not been altered in any way, there are a whole host of other signs that may be detected and that have been connected to specific nutritional imbalances as well as dietary and lifestyle factors through years of clinical work by live blood analysts. There's also another test that we use that forms part of blood analysis called dry blood analysis. Now, this test is not used in any way in conventional laboratory tests, so there's no correlation with standard hematology. And this is also one of the other fundamental reasons for the criticism of live blood analysis by conventional medicine. There isn't really sufficient scientific research to a large enough scale to validate live blood analysis. Most of the information that is not taken from hematology is based on clinical experience, so not clinical trials and other similar research models.
Okay, thank you. And why do you think this is? Is it because we don't have more research?
Well, the answer to that is quite simple. Where's most research or most medical research done? Some of it is done at medical universities and the rest is done by pharmaceutical companies. Now, live blood analysis is not taught at university level, so we can't expect any research from there. And we know what the odds are of research into live blood analysis being funded by a pharmaceutical company. The only person, or only people rather, who are qualified to conduct scientific research into live blood analysis are live blood analysis practitioners who are all too busy running their own practices to get involved with research. Now, I've looked at this in quite a lot of detail because as a practitioner of live blood analysis myself, I know that it is accurate and it is reliable, and I would like to see more scientific research to prove this. And there are three essential needs that have to be fulfilled to conduct a suitable study. And also one of the reasons why we don't have enough scientific research into live blood analysis is because it's actually very difficult to fulfill all of the three requirements. Now, firstly, you need funding. Who is going to fund research into a large-scale study of live blood analysis? This could be extremely expensive. The second requirement is suitably trained and experienced practitioners. As I mentioned, they're all too busy running their own businesses to get involved with the study. And the final requirement, as they say last but not least, is a suitable design. The study needs to test live blood analysis on its merits to show that it is effective in what it has been developed for and used for.
Well, that's a good point because many of the studies didn't focus on the aims of live blood analysis.
Well, that's absolutely correct. There were studies where they performed live blood analysis on groups of people with known medical conditions to see whether these could be accurately detected with live blood analysis. Now, the outcome of this research was actually very positive, and in the conclusion, the researchers stated that an equal sensitivity was demonstrated between live blood analysis or dark field microscopy and standard chemical analysis. Another recent study demonstrated the value of live blood analysis as a screening tool for metabolic syndrome. The study showed a strong correlation between live blood analysis and specific conventional laboratory tests for metabolic syndrome, as well as a significant correlation in white blood cell differential counts between live blood analysis and automated analysis. The problem is that these studies were not of a large enough scale, and again, they didn't really test live blood analysis on its merits. Now, there have been a number of scientific studies that prove the link between specific blood anomalies and specific health challenges. For example, the presence of thrombocyte aggregation or groups of aggregated platelets has been shown to be strongly associated with an increased risk of heart disease. One of the challenges is that there really are no conventionally accepted tests for most of the important conditions that we are able to detect with live blood analysis. Conditions such as latent tissue acidosis, toxicity, or an intestinal candida overgrowth are not really accepted in themselves by conventional medicine, and there are no conventional tests that we can use then to confirm the presence of these conditions in a patient. So the unique ability of live blood analysis to detect these conditions actually makes it very difficult to develop an objective study to test its accuracy. The best type of study is perhaps a large-scale retrospective survey to assess the changes experienced by clients after live blood analysis. So in other words, to look at the results experienced by clients that have been through the process of having their blood tested and who followed the protocols.
Okay, so you mentioned that most of the information used in live blood analysis comes from the clinical experience of practitioners who developed this technique over the years. So could you tell us a little bit more about the history of live blood analysis, where it all started and how it got going?
Yeah, absolutely. Well, one of the first pioneers of modern live blood analysis, as we know it, was Professor Marcel Bessy. He was a French hematologist who lectured at the University of Paris in the 1960s and 1970s. Now, he wrote a number of books describing the value of evaluating blood in a living, unchanged and non-stained state. He argued that all hematology labs should change from analyzing stained blood samples to live samples, mainly because the live samples, with live samples you're able to observe the dynamic life processes at the cellular level unfolding in real time. Now you can capture events and sequences that are impossible to see in static, dead, stained slides. Now this makes so much sense if you think about it logically. Surely you should be able to obtain much more valuable information from a fresh sample that has not been altered in any way by the addition of chemical stains and anticoagulants, etc. Now, since Professor Bessy, there has been other researchers that have continued to connect the dots between what is seen in the blood and the client's state of health, and ultimately to the interventions that are consistently successful in correcting a specific anomaly. Thanks to the work of these researchers, we now understand the physiological basis and processes of most live blood anomalies. So in other words, we know the underlying processes that lead to the development of a particular anomaly in the blood. So for example, in live blood analysis, we always treated the presence of fibrin as a liver stress indicator. We now know that there are actually two separate mechanisms, physiological mechanisms, for fibrin formation that both relate directly to the liver. Now there was also Professor Enderlein, who was a German bacteriologist from the early 20th century, who developed a theory called pleomorphism. Now some live blood analysis courses only tend to teach analysis from a pleomorphic perspective, and this is another cause for controversy in live blood analysis because pleomorphism is not accepted by conventional medicine. The research into the validity of pleomorphism has been relatively inconclusive, so we don't spend a lot of time on the pleomorphic perspective of the various blood anomalies in our course. There have been some studies that have validated some of Enderlein's work, but I think we are still many years away from being able to conclusively prove or disprove all of Enderlein's theories.
Okay, thank you. So back to the questions. So why does live blood analysis attract such negative press?
Well, you know, live blood analysis is a tool used by natural health practitioners. Unfortunately, there's still a very great divide between conventional medicine and complementary medicine. because the two philosophies are so fundamentally different. Here we have a tool that can be used to detect conditions that conventional medicine is still largely in denial about, such as the need for detoxification, heavy metal toxicity, latent acidosis, and so on. So I think it's fair to expect some resistance from conventional medicine as a result of that. The other factor is, of course, the fact that most medically trained practitioners don't know anything at all about live blood analysis, and they immediately assume that it must be a diagnostic tool. Also, some negative press comes from the perception that live blood analysis is only used to sell products. Now, there are some practitioners who use it as a tool to mainly sell their clients a bunch of supplements, and the negative press is justified in these cases. However, the problem does not really lie with live blood analysis, but rather with greedy, unethical practitioners. And this is certainly not unique to live blood analysis. Other tests are used in the same way, and the same types of people are found in every other industry as well. So we can't deny the delivery of a useful service because of the abuse by a few charlatans. If we did that, we would really have no healthcare system at all.
Absolutely. And is live blood analysis legal?
Well, live blood analysis is not regulated, although there are some restrictions in place in some states in the USA. Generally, however, if you can show that you have received formal training in live blood analysis, you will be able to use this technique, provided, of course, that you don't make any claims about diagnosis. We have not been able to find out which states in the USA have restrictions about live blood analysis, but I know of practitioners all across the USA that use live blood analysis without any incident. Although one has to be careful, depending on your scope of practice from your other qualifications, to prescribe treatment. Most of my clients in the USA state that they use live blood analysis as a tool to educate their clients about the impact of diet and nutrition on their health, and then to guide the clients in what changes they need to make to achieve and maintain health.
Okay, and can anyone take the blood sample, or does it have to be a medical doctor?
Well, it is just a finger prick, so in most countries anyone can really do it. I haven't really come across any restrictions for lancing fingers. It's really only when blood is drawn from blood vessels that a qualified nurse or a doctor needs to do it.
And some people might think that it all sounds too good to be true. Is there a catch?
No, as long as you use live blood analysis for what it is intended to be used for, you won't experience the benefits of live blood analysis if you try to use it to diagnose specific medical diseases, or if you don't have sufficient training in the theory and the practice, or of course if you don't have a good enough microscope system.
Okay. Why don't doctors and hospitals use live blood analysis?
Well, the value of live blood analysis lies in assessing the health of the body's internal environment, or the terrain, to highlight imbalances that can be corrected through nutrition, dietary and lifestyle interventions. It's primarily a preventative tool for people who are proactive about their health. Now, the conventional medical system is more concerned with disease care, diagnosing and managing diseases with drugs and surgery, rather than preventing diseases and helping the body to heal itself.
Okay, thank you. And going back to the Wikipedia definition, has anyone thought of going to Wikipedia and correcting some of the misstatements there about live blood analysis?
Yeah, we actually did have a suggestion from another attendee about this as well, so we are looking into it and hoping to be able to update this information.
Do you know how we go about it, Dr. Okker?
Apparently there is an area where you can actually edit, so and you can submit an edited version of the article. So I need to look at that in more detail and see if we can send some information through to them. Hopefully we'll be able to get this updated. But I know of other natural modalities. I know of oridology, where they analyze the signs in the eye and the iris to assess various health conditions, and I've read that the submissions that people sent were not really dealt with very well, and you know, they were rejected. But I think it is absolutely a very good idea to try and get things changed there.
And from the same attendee, it says you have to sign up to be an editor and expect flame wars. So I don't know what they are, but is there any help in having numbers of people? If anybody knows anything about this, you know, please send it in to us, because you know, obviously we can get quite a number of people together to try and make some changes. So
Absolutely.
yeah, so please send that information in if you have any, and we'll send it out because that's the end of the questions. It would definitely help if numerous editors would sign up to correct it. Well, thank you very much for that. We'll be sending out a copy of this webinar tomorrow, so I will get as much information as I can about that. And maybe if we all went to Wikipedia and did something, then maybe that would help. So I will send you directions on what to do. It would be brilliant if you could help us, and we could all try and make some changes there. Yeah, great idea. So any more questions, please pop them in the box. But that brings us to the end so far, because we've run out of questions. So thank you very much for joining us. If you do have any more questions, please email them in at info@livebloodonline.com. Also have a look at our website, livebloodonline.com. And if you'd like to join us on our next course, which is beginning Tuesday the 27th of September, please email us at info@livebloodonline.com, and we'll send you an information pack and answer any of your questions. Okay, so that seems to be the end of everything. Anything to add to that, Dr. Okker?
Well, no, I don't really have anything else to add. I think we've discussed everything, and if there are any questions, we'll certainly look at answering them as well.
Okay, marvellous. So again, thank you very much for joining us. Thank you and goodbye from me, and thank you from Dr. Okker.
All right, thank you very much. Goodbye.